Hey everyone, my name is Mario Martinez, and today we're going to be going over what you should expect for your first couple EMT basic rideout. We're also going to be going over a couple tips that you can use, as well as a respiratory distress call that we're going to be simulating together. And we're going to do it so in the eyes of an EMT basic student. As a student, we want you to participate as much as you possibly can. That means trying to get involved, such as obtaining vital signs, establishing advanced airway equipment such as a nasal cannula, a non-rebreather, a nebulizer, hint hint, or a bag valve mask. You can also try utilizing some of your EMT basic medications that you may have learned previously in class. If you forgot them, okay, that's fine. We're going to work with you on them, from setting up the medications with your patient, as well as helping you administer the medications. We don't expect you to be a pro, so that's okay. You're doing a rideout as an EMT basic student. Also, try to remember your mnemonics such as sample or OPQRST. You're going to find a lot of times whenever you're on scene, you may be struggling just obtaining vital signs as is. But once we get them in the back of the box and we have 20, 30 minutes riding to the hospital, that's a great time to practice asking questions to your patient, such as signs and symptoms, allergies, medications, past medical history, last oral intake, and events. For OPQRST, if your patient went into some type of trauma, then we can consider onset, provocation, quality, radiation, severity, and time. Now, everything that can go wrong is probably going to go wrong. You're going to be trying to put a blood pressure cuff on a patient and you're going to realize, hey, it's a lot harder to do on a patient rather than doing it on one of my peers. You can be putting a nasal cannula on a patient and realize, oh my gosh, this is so much harder than the mannequin. I'm actually choking my patient. That's okay. It would be weird on your first couple days during clinicals that you'd end up being a pro. We expect you to mess up on every single thing. But we want you to do that and participate as much as possible, because it's good if you mess up around us, but when you're by yourself, actually riding on the box as either EMT basic as a driver or as lead, instead you can remember, hey, I was riding out with Mario and I messed up on the blood pressure cuff, or I messed up on setting up a nebulizer on my patient or a nasal cannula. Now I know what to do on my actual patients. We're not going to make fun of you in any way. I've never seen that done before. We just want to see you actively participating and making all those mistakes with us. We don't expect you to memorize the box, but we'd like you to know a couple things before you do your rideouts. You're not working here for 48 hours at a time or 24 hours at a time, so we don't expect you to memorize everything. Just don't be afraid to ask questions, get involved, try to be the best student that you can be. So with that being said, let's go ahead and take a look at the box together. All right, everybody, so here's Medic 72. As you can see here, this is where we put the backboards at. If you need to access them, they're going to be in the backside compartment. And they're going to be on the outside. Over here we have our jump bag. This is where we keep some of our main equipment. So we'll have like our BVM, some LMAs in there. We'll have IV equipment. We'll have some of our airway equipment, our IO kit, things like that. Over here we have the trauma bag and we have the medication bag. Here's where we keep our IV equipment. So you can see here we have some of our IV catheters, our saline flushes, things like that. Our monitors over here as well. We have our airway cabinet, which has things such as like our nasal cannulas, our non-rebreathers, our BVMs, our back valve mask, our nebulizers, CPAP equipment, endotracheal tubes, things that you really won't have to worry about depending on your level of skill. We have our trauma cabinet over here, which has like our OB equipment. We have our hot and cold packs. We have our protocol book in there. Some of our splinting equipment, our 2x2 gauzes, our 4x4 gauzes. If we look over here, we have our tourniquet that's kind of tucked away, but if you zoom in, you can kind of take a look at it. We really want to know where our tourniquet is at, since that's one of our more critical pieces of equipment. We have our miscellaneous cabinet, which also contains some like stretcher sheets. It has our lidocaine drip, our levofed drip, and our TXA equipment, as well as just some extra gloves. In this cabinet here, we have our saline bags in case we need to spike a bag. So everyone, if you want to be successful in your rideouts, you really want to make sure that you take out the stretcher. It's always a good idea to do this kind of practice. Don't be afraid to go out with the crew, ask them, hey, I've never seen the stretcher before. Can you help me pull it out? They're going to respect you whenever you see that. They'll work with you on it. And if you can pull out the stretcher with the other crew members, you'll already make yourself a huge asset to this team. So you can see here, I'm pulling out the stretcher right now. We have a system where we have to release the wheels at separate times. Plus is to play, minus is to put away, is generally the rule of thumb whenever you're dealing with any type of stretcher. And as you can see, I'm going from a unload position to a load position. That's where it raises past a certain elevation, so I can hook up the stretcher back into the medic unit with a safety latch. And I'm just going to raise up the wheels one by one. And it's a really great stretcher because this way I don't have to potentially put my back in any type of danger. So if you're not familiar with the stretcher, maybe you need to pull it out more than once. Maybe you need to ask the crew, hey, I'm going to go back downstairs and work on it by myself. Show that you're trying to familiarize yourself with this equipment that's foreign to you. So we're in the back of the box right now. We've just been dispatched to a respiratory call. One thing that you can do as a student is you can think, okay, it's a respiratory call. What are some big things that I need to know about? Okay, well, I need to know where my monitor is, and I need to know where my respiratory cabinet is, right? And you're riding to the call, you have 5+ minutes. One thing that you can do is you can go up to the lead medic's window. You can say, hey guys, what does the note say? Say, hey, what does the note say? As a lead medic, whenever I hear a student say that, I'm like, yes, this guy is actively participating. He really wants to know everything that he can learn about this call. And then I'll shout back to the student and say, hey, I have a 28-year-old male. He's sitting down inside of a building in a classroom right now, and he's having trouble breathing. It says that he ran out of his medication that he usually uses to help him breathe. But basically that tells me, oh, the student's ready to participate. He's asking good questions. He's starting off on a strong foot, right? So as a student, you can look at the respiratory cabinet and say, okay, what's the worst case scenario, right? Well, for a breathing call, I can think maybe I need to use the bag valve mask. Now, I don't work here all the time, right? I'm only a student here that's going to be here for 8 hours. So let me take a look while we're riding in the box. Oh, my bag valve mask, where's it at? It's up here. As a student, now you know, right? We're riding around. Where's my non-rebreather? It's over here. Awesome. Hey, let's say if I'm on a call with you and we have the patient in the back and I ask you, can you set up a non-rebreather on the patient? Can you set up a nebulizer? Where's it at? It's right here. And if you can say, okay, you can grab it, pull it out and show me that you know, that's fantastic. I love to see that. That shows that you've really been participating. You checked off your box earlier. And sure, you may not remember it right off the back. That's okay. You taking a look at it while we're riding to a call because you asked questions to me earlier about what the call is about can help prepare you later for the call. While I'm riding to a call, I can be like, you know what? I want to be prepared so as soon as we get to that call, I can jump out and be useful. One thing that I want to prepare, I want to grab my gloves early. And I want to throw my gloves on early. So that way, I'm not wasting any time. I don't look foolish coming out of the box while I was trying to throw on my gloves. We need to be ready to go. This guy may be in cardiac arrest, and our dispatch notes aren't telling us everything that we may initially want to know. They may only be able to gather certain information. So we're riding to a call. We've got about 5 minutes to play with, right? So let's take a look at our medication bag while we have the time, right? Let's open it up and let's go ahead. And while we're riding to our call, let's say, what's something that I should do really quick? I should figure out where the albuterol is, right? We may need to use albuterol for this call. That's one of my EMT basic airway medication drugs. Here it is. Here is our albuterol. And now I know that if I show up to a call and the lead medic says, hey Mario, or hey student, for this instance, hey Jacob, can you go ahead and set me up a nebulizer treatment? If I see a student pull out the medication bag and pull out albuterol, I'm going to say this guy has really done the most. He knows what he's doing. And you can set yourself up for success while we're driving over to a call. Utilize the time we're going over and look at your box, look at your surroundings. Don't just sit here and just wait for the call to happen. Ask questions to yourself. Say, what's the worst case scenario? This is off topic to a call, but if we're going to a trauma call, for instance, and I can say, well, we don't know what happened, just that he got hurt, he was in a fight. Okay, what's one of the immediate things that I need to know about? Do I need to know where the 4x4 gauze is? Not really. If I'm throwing on gauze, I can take my time, I can search a little bit, but something that I want to know of right away, where's my tourniquet? Because I got about a minute to set it up before they bleed out and pass away, maybe 2. Here's my tourniquet. As a student, look back here. Say, where's my tourniquet? Where's my other tourniquet in my trauma bag? Look at the trauma bag. Look inside and find your other tourniquet. If we're going to a traffic accident, then we can say, okay, where's my traffic vest at? Oh, it's right over here. I'm going to throw it on before I get down on the call and be a great asset to the team. I can maybe set up the monitor. I can look at the monitor before I get on scene. I might not remember where everything is in every patch. And I can open it up, right? And it's riding around. I got to be careful, but you have to get used to this. Okay, my blood pressure cuff and pulse ox is right over here. I may need that on a call. My electrodes are right here. What's in this compartment? It's my thermometer. It's one of my 6 basic vital signs. I may need that. Here's my power button. Here's my AED pads right here. And here's my glucometer. Also, I may need to unplug the monitor and get it ready to pull out and go. I may need to put it on the stretcher for the lead medic and the driver to utilize. So you should consider your time back here driving to a call as a good way to prepare yourself for success. All right, so we're gonna get the stretcher out, the medication bag, and the jump bag. Jacob is going to be simulating my EMT basic student that's riding out with me. And this is something that we take to a potential respiratory distress call. Fire department, coming in. Fire department. Just making sure that they know I'm coming in. Knocking on the door. Yep. Fire department coming in. Here. Student, while I'm asking you questions, can you go ahead and set up some vital signs?
Okay.
And go ahead and start with the pulse ox, okay?
You got it.
Hello, sir. What's going on?
Can't breathe.
You can't breathe? How long have you been like this for?
45 minutes.
45 minutes? What were you doing whenever this happened?
Just out walking around.
Just walking around? Have you ever felt like this before?
Okay. Yeah.
You have? When was the last time you felt like this?
2 days ago when I was out walking around also.
What did you do to feel better?
Yes, sir. Put this around your arm, okay? I have an inhaler, but I ran out.
You ran out of an inhaler? Is it now a albuterol inhaler?
Yes.
Okay, and you just ran out of medication? Well, we're checking your pulse ox right now, but we do have some a nebulizer and some albuterol. If you want to go ahead and set that up.
Yeah, can do that.
And we can go ahead and give you that medication, okay, to make you feel better. All right? So, we'll cut. Can I bring this in a bit? That should be a decent shot right now, right? You could probably stand even closer right here, and you can show yourself like setting it up.
Okay.
So guys, we're pausing for a moment, but as you can see here, we have our nebulizer and we have our albuterol treatment. So Jacob's gonna go ahead and show you guys him taking out the nebulizer, just like we went over in another past video. And while he's setting up everything, I'm going to go ahead and hook up the O2 tubing. And we're going to set our nebulizer at 6 to 8 liters per minute. So you can see here, we have the area we're going to dispense the medication. He's going to go ahead and pour in the albuterol. This is something that you should know how to do as an EMT basic student. He's going to dispense the medication like so. You can see it filling up in the reservoir here. Nice. We're going to hook it up like so. This can be very challenging for new EMT basic students. Don't worry about it though. It's okay if you mess up. We just want you to participate. He's going to hook it up there. And we're going to set it at 6 to 8 liters per minute. So as you can see, 6 to 8 liters per minute. We're going to start to create this fine mist. At this point, we would attach it to our patient. We're not going to do that to our partner today, just because this is only a demonstration. One other thing that we can do that we're not going to visualize right now is I can listen to lung sounds, right? So I can listen to the back sides of his lungs. And if I was doing it mimicking on the front side, I'll listen to one side and then go across, then listen to the other side and then go across. We don't want to mix up our order. We want to stay checking the left upper lobe, then the right upper lobe, compare them. Inspect the left lower lobe, the right lower lobe, and then compare them. So I'll be doing that like so with our patient. My EMT basic students done an amazing job so far. Sir, how do you feel after taking that nebulizer treatment?
I feel a lot better and I can breathe now.
That's good, that's good. That's what we want to hear. Well, I would still recommend going to the hospital. We'd like to take you to get further assessed. I think that'd be a good idea. And maybe if you need to get a secondary treatment or something along those lines, that may be really beneficial to you. Are you okay with that?
Yep, I think that'll be best for me.
Okay. Well, good thinking. So the next thing that we want to do is we want to go ahead and put our patient on a stretcher. And so what we can do before we get up to him, and while he's waiting, maybe he's receiving more of his treatment, we can go ahead and seatbelt everything. We want to use all the straps that we have available in both of our guardrails. We can lower our stretcher, and while we're setting him up, we can go ahead and discontinue him from the pulse ox. Disconnect the blood pressure cuff. Bring it up to him as close as we can. All right, sir, we're going to help you up here, okay? And go ahead and lock the wheels. Good. All right. We just need to sit down as close as you can to the edge of that stretcher there. We'll help swing up your legs, okay? There we go. Let's go ahead and get that guardrail up so he doesn't fall. We'll put some seatbelts on him. Thank you. Whenever you're doing this, if you're using the female end, you just want to hold on to that side, and the male end is going to be the one that moves up to you. You don't want to both try to connect to each other. Okay, we have our third one.
Right here, Mario.
Nice. And we want to be really careful and set our patient up in a way or a fashion that they are able to maneuver their arms. We don't want to trap their arms inside. So you can see we have our patient fully secured. He's able to move his arms because we're not trapping it inside. If we need to raise up our patient, we can. So, we're in the back of the box, and we've reset up our vital signs and established them on our patient. We went ahead and swapped for a mannequin so we could stop bothering the other guys. As a student, you may have been focused purely on vital signs and establishing an airway on our patient. That's completely fine. We're in the back of the box. We take about 15 to 20 minutes to transport our patient. It's a great time to utilize some of those sample questions and OPQRST questions we talked about earlier. Also, we want to reassess our vital signs. We administered a nebulized treatment to our patient and his SpO2 increased and he generally felt more comfort. However, we want to reassess their vital signs every 10 to 15 minutes since this is a relatively stable patient, a critical one. We want to do it every 5 minutes. And if we see that his SpO2 is going down a little bit, if we start to hear some audible wheezing, we may want to consider administering another round of the nebulizer treatment. Now, for Anavil, for instance, for an adult patient, we're going to give 5 milligrams or 6 mLs of albuterol every 3 to 5 minutes until the respiratory issue goes away. We want to reassess vital signs constantly while we're doing this too. We want to check out the patient's heart rate because albuterol may actually increase their heart rate to a sinus tachycardia from a sinus rhythm, along with all of our other vital signs as well. That's just an example. So while all that's going on and we're reassessing our patient, as lead medic, I may be focusing on writing up my narrative because I don't want to get behind and get in trouble. This is a great time for you as a student to sit down here and ask our patient some questions. So if I was acting as you, as the EMT basic student, while the lead medic is typing away, I would say, "Sir, how are you feeling right now? Do you still feel any issues when it comes to breathing?" "No, I feel fine." "That's great. Are you allergic to any medications?" "I'm allergic to penicillin and sulfa drugs." "Okay, we'll make a note of that." The lead medic is shaking his head. "Thank you for getting that info." "What medications do you take?" "I take atorvastatin. That's a cholesterol medication. I take lisinopril. That's a blood pressure medication. I take albuterol. That is for asthma, like what the patient is potentially experiencing right now. But I ran out of my inhaler." That's good to know. "What past medical history do you have?" Well, we already know that he has hypertension issues, he has cholesterol issues, and he has past asthma attacks that can still affect him to this day. To be more specific with that question though, and to find out anything that may be extreme, I may go up to my patient and say, "Sir, do you have any past cardiac or respiratory issues that I should know about? Any past cardiac or respiratory events? Like, have you had a heart attack in the past, a stroke, or any other significant respiratory issue that you may have had?" "No, I don't have any significant medical history that I can think of." "Okay, great. When was the last time that you ate something?" "I had a taco earlier today in the morning." "I'm kind of jealous. I wish I had one too." Joke around with your patient a little bit, you know? Don't make it all too serious. You want to build up a good line of communication with your patient. "So, sir, what exactly caused all of this to happen?" "I know we asked that earlier, but you can go ahead and ask it again." Well, I was walking outside, and then suddenly I felt like I may be having an asthma attack, so I went inside and called you guys." "Okay, great. Do you have any pain right now, sir?" "No, I don't." "Fantastic. If he did say we had pain, we could go through our OPQRST. Besides that, we just want to reassess vital signs constantly, and we're going to go over a hospital report that we can give to an ER staff. For instance, if I was the lead medic on this call, and I was calling us into, let's say, Spawn Shoreline, I may say, "Medic 72 to Spawn Shoreline. Spawn Shoreline, go ahead. Medic 72, we're en route to your facility code 1 with the 28-year-old male patient with a GCS of 15 currently complaining of respiratory distress about an hour ago. The patient's vitals are at BP at 136/74, heart rate is at 118, they're setting at 91% on room air, but they're currently at 96% on a nebulizer at 8 liters per minute. We gave him a round of albuterol at 5 milligrams. Their temp is at 98.4 degrees Fahrenheit, and their blood sugar is at 84. We're ETA your facility in approximately 10 minutes. Copy that. See you on arrival." So at this point, we've brought our patient to the hospital, and we put them into their assigned room. Right now, I'm going to be communicating with the nurse. I'd like for you to stand right there and listen to me talk to the nurse and give report. My other partner can worry about cleaning the medic unit and cleaning the stretcher, but I want you to hear everything I tell the nurse, because you're going to be telling this to the nurse by yourself one day. So we're bringing in a 28-year-old male patient. He was outside walking around for approximately 1.5 hours ago. Whenever he felt that he was getting short of breath, he went inside, called 911. He was concerned that he might have been having an asthma attack. He just ran out of his albuterol inhaler that he carries at home. So he assessed his vital signs. Last known BP was 136/74. Heart rate was at 118. He's standing right now at 96%. It was at 91% on room air at home. We gave him 5 milligrams of albuterol at 8 liters per minute for a nebulizer treatment. Currently now he's standing at 96%. His temperature is at 98.4 and his finger stick is at 84. Some things to note: he is taking lisinopril, atorvastatin, and albuterol. Again, he ran out of his medication. He also is allergic to penicillin and sulfa. Do you have any further questions? No, that should be everything. Good job, guys. And then from there, we'll head back over to the medic unit. We can go help our partner clean up the rest of the box. But it's really important that you hear those notes whenever we're talking to a nurse. That way you can prepare to ask and answer those type of questions whenever you're passing off a patient. Well, everyone, I hope that this answers some of your questions you may have during your rideouts. Remember to have fun and focus on your patient care, obtaining vital signs, asking questions. Try to get some of your pertinent negatives. Do things like asking about if they have nausea, vomiting, diarrhea. That's a great way to add a couple of things that the patient doesn't have in your narrative. But with all that being said, thank you guys for watching, and I will see you on the next one. See ya.